everyone. My name is Whitney and I'm a registered dental hygienist here to talk about something that's all over social media and the news right now, veneers. Are they bad? Are they good? Are they dangerous? Let's talk. So veneers are not bad unless you get bad veneers. This is because veneers are not just a quick beauty hack. They're a dental procedure that permanently alters your teeth. Yes, permanently. This is not like getting your nails done. Your teeth do not grow back. Are there no prep veneer options? Yes. I will link that video of mine below that explains the different types of veneers. Some require your teeth to be shaved down a little more than others depending on the health and orientation of your teeth, what your teeth qualify for, and what type of dentist or cosmetic dentist you're working with. But for the purpose of this video, and what's wild is that there are now people online calling themselves veneer techs. Some pretending to be dentists, others not even pretending, who are placing veneers without a license. So the issue is, even with the no prep veneers, placing a veneer is not like applying a press-on nail. If something goes wrong with your tooth underneath, it's often irreversible. If you place a veneer over decalcification or weakened tooth enamel, it's going to quickly cause that tooth enamel to erode and turn into a cavity. And having a cavity, tooth decay, under a fake tooth, that's bad. It will spread and grow quickly because you can't properly remove plaque bacteria anymore with a toothbrush since it's stuck under the veneer, right? And in addition to cavities, if the veneer is placed incorrectly and the cement is irritating your gums, you can quickly get gingivitis that turns into gum disease, which is not ideal since gum disease increases your risk of tooth mobility and tooth loss. I've been seeing this happen more and more, and that's what inspired me to make this video. For example, a patient recently scheduled an appointment with us, and the reason for her appointment was all of her top front teeth felt loose. So we never saw her before. She was a new patient that came in and she ended up having severe periodontal disease from veneers she got like 4 years ago from a veneer tech and hasn't seen a dentist since. So that bacteria was stuck between the gums and the teeth and the veneers. The cement was irritating her gum tissues and she couldn't clean around them properly due to the improper placement. So that bacteria started eating away at the bone that holds her teeth in and she needed to get a periodontal referral because we weren't sure if we could save those teeth. They were hanging on by threads. So the perio specialist will evaluate her and see. But yeah, she might need to get them pulled and replaced with implants. Long story short, all of this could have been avoided if she saw a dentist to get her veneers instead of a veneer tech. Because if you have uncontrolled gum disease that you weren't aware of before getting veneers from a veneer tech, that's a problem, right? Just like cavities, enamel erosion, decalcification, etc. But when you go to a licensed dentist, they will make sure your teeth and gums are healthy before placing your veneers and placing them correctly so you don't waste your money on veneers that won't last. So if you think you're going to save money by seeing a veneer tech, you are gambling because you might be okay, but more likely than not, especially from what I've been seeing in the industry, you're going to end up paying even more money in the long run to fix any issues that those veneers caused your gums and or teeth. Okay, so all the veneer tech risks aside, I think I've made my point about the risks of getting veneers from a veneer tech, the damage veneer techs can cause because they are not dentists that fix your oral health issues before placing them, and they were never trained on tooth morphology and gingival structure to make sure they are placing them correctly. But one more thing before we go. Even when you're seeing a dentist for veneers, many patients want veneers as a quick fix for things like crooked or discolored teeth, and I get it. You want that bright, straight smile. Who doesn't? But here's the thing. Braces and teeth whitening can often get you that smile you want without having to shave down your teeth or commit to something so invasive. And your dentist will let you know what they think is best for your mouth, especially if you ask. I'm only bringing this up because oftentimes I'll see the dentists that I work with recommending braces and or Invisalign and then whitening to a patient who wants veneers, and the patient is not wanting to hear it, turning them down, saying, no, I'm just here for veneers. My advice, just hear out your dentist. They are going to give you all your options, and the braces whitening option is really the most conservative option. You get to keep your own natural teeth, and once you're done, you're done. Whereas veneers often need to get replaced every 10 to 15 years. And let's talk about the money. Real veneers done right by a cosmetic dentist, they are not cheap. And there's a reason for that. You're paying for quality care, custom treatment planning, and patient safety. And many people get amazing results with veneers. But I'm just letting you know that if your dentist recommends trying a more conservative approach, just hear them out. Even if veneers are what you've had in mind for fixing your smile, there really may be better options to fix your individual teeth. So if a dentist says you're a great candidate for veneers, great, but just make sure you hear out all the options for your personal mouth. In conclusion, if you're thinking about veneers, please go see a licensed dentist. If you go to a veneer tech to save money, you might save money up front, but you will end up paying more money in the long run to fix the damage they cause. And even when you do see a dentist, be sure to talk through your goals and listen to the the recommendations. It's always your choice in the end, but remember, dentists went to 8+ years of school, college to study teeth. It's worth hearing their perspective on what they recommend for your personal teeth. If they think braces or Invisalign and then teeth whitening would be better for you, hear them out. Also, pro tip, I've noticed that when patients ask the dentist,
"What would you do if you had my teeth?"
simply asking that, it really opens the conversation to all your options. You might be surprised as to all the other options that can fix your teeth without needing the drill to ever touch your teeth. So overall, if you do decide on getting veneers, awesome. Just make sure you do it the right way, because like most things, you get what you pay for. I hope this video helped you. Please like, subscribe, and turn on your notifications if it did. And let me know in the comments if you have veneers, want to get veneers, or even what do you think about all these veneer techs popping up? Have you seen all the Instagram pages of veneer techs trying to open up their own offices in their basements? Yikes! Infection control issues. Anyway, until next time, speaking of Instagram, I'll see you on Instagram at Teeth Talk Girl. Peace, love, and teeth.